Nate, I know you're on my left side today. Yesterday, I kept looking for you at a different place. Thank you for joining us on a Saturday afternoon. This should be brief, but we always want to keep you and the public updated on exactly where we are with the coronavirus here in Arkansas. Since yesterday, we have had 3 additional presumed positive cases. All of those 3 new cases are related to the original exposure in Pine Bluff, and Dr. Smith and his team are working that in accordance with public health criteria. In addition to that, I want to make clear that we do have our Emergency Operations Center activated. It is fully activated. I asked Director Gary to make sure that happened, and so they're standing up with all the agencies represented. He'll discuss that in just a moment. And then thirdly, I've also authorized the Arkansas National Guard to be activated to the extent necessary to help with logistics, transportation, call center support. An update from yesterday when I indicated there was a backlog in the call center. We have added lines. We have moved resources there from other call centers, and now recognizing the capability of the Arkansas National Guard with EMT support, they're capable to add to that equation as well. I want to make sure that they're ready and available, and so I have activated them as an additional resource to make available to our public health team. With that, I'd like to have Director Gary to make a comment on the Emergency Operations Center, and then Dr. Smith will give a medical update on the current situation.
Thank you, Governor. The Arkansas Division of Emergency Management is activated at level 1. During a health emergency, the Division of Emergency Management becomes a support agency to the Arkansas Department of Health. This is something that we train on a regular basis. Dr. Smith and I meet monthly and have for the 4 years that I have been there at Adam. So this is just the practicing, the exercising that we do for events like this. As part of our activation, our Joint Information Center is activated, so we will be pushing out information through them and coordinating that, of course, with the health department. Also, under normal procedures for our activation, we are doing coordination calls with our local counties probably every couple of days right now, and we may make those more frequently if we need to. But we're keeping those communications going with our local contacts to make sure everybody's on the same page on this incident.
Thank you, Director Gary. Thank you.
Thank you again for being here. Thank you, Governor, for your support, and Director Gary for your support of our efforts. Since our last briefing, we've had 3 new positive cases. All 3 of those were healthcare workers who came in contact with our first patient in Pine Bluff at Jefferson Regional. All of them have been in isolation, and none of them themselves are in the hospital. We're continuing to monitor the situation. Our testing priorities right now are 1, those who are known contacts to known cases. Second, those who have severe illness consistent with COVID-19 in other parts of the state. And then as we have the ability, those high-risk outpatients who have syndromes consistent with COVID-19. In this way, we will continue to get the information we need from our current clusters and also have some awareness of disease activity in other parts of the state. As we identify cases outside of the central Arkansas area, we will refocus our efforts and adjust according to the risk. And we'll continue to update you. Thank you.
As Dr. Smith indicated, we are managing the current circumstances, which includes 12 active cases that have tested positive. What we're most concerned about is what we do not know. And what is very logical is happening, that there are other cases that are out there that we're just not able to confirm as positive because of limited testing capacity. Dr. Patterson at UAMS has worked diligently on addressing this issue, and I wanted him to speak to it, followed by Dr. Bledsoe, our Surgeon General, in regard to what the public can do to help us.
Thank you, Governor Hutchinson. We appreciate all the support that we've received from the Governor's Office, from the legislature, and also from our federal delegation in D.C. The hospitals across the state are in constant communication with each other, and I think that everyone in the state of Arkansas needs to be encouraged that our healthcare system is functioning exceptionally well under the stress of the COVID-19 patients that we have recently identified. And in fact, in many ways, our healthcare systems are functioning at a very heroic level. We have the ability to take care of all the patients that are presumed to be infected or potentially infected, and many more on the inpatient side. But we are experiencing two main bottlenecks. One bottleneck, as Governor Hutchinson mentioned, is the bottleneck related to testing. ADH is able to do about 20 tests per day. There is testing available through LabCorp and Quest, but that testing has a protracted turnaround time, and it's necessary for us to figure out how we can increase the number of tests that can be done rapidly here within Arkansas. We are working with manufacturers and also getting support from the Governor's Office, from Senator Cotton and Senator Bozeman, to get additional machines and testing kits here in Arkansas. And our hope is that we will have an additional machine available that will increase our capacity from about 20 tests per day to about 160 tests per day sometime within the next week or so. That's dependent on a machine being delivered to us, and we're working very diligently with manufacturer to make sure that we remain a high priority destination for the machines. There's obviously a great deal of demand for these machines nationwide, but our need is a critically important one. So we will have more to report to you as we know more about when additional testing can be done within the state. But once we are able to increase that capacity, we'll be able to do testing with a 6-hour turnaround time rather than a several-day turnaround time. And that will be helpful for all of us as we think about how we prioritize testing. The other bottleneck that we're experiencing is the bottleneck in terms of people who are mainly worried well people who are coming to our emergency rooms and clinics. And it's really critical for us to emphasize the fact that if you are concerned about the possibility of infected and you're well enough to be staying at home, that's where you need to be. And that's why we have created online and telephonic resources for people to be screened for the possibility of COVID-19 infection. UAMS Health Now is available on your iPhone, your iPad, your laptop computer. It's a free service, and we're doing over 150, upwards close to 300 screenings over the past 24 hours, and I'm sure that number will continue to increase. We also have a 1-800 number, 1-800-632-4502, for anybody who has symptoms. And again, I would emphasize, if you have symptoms but you're well enough to stay at home, please don't come into the hospital if you don't need to, because it's really crowding out resources. We also have a turnaround near the Jackson Spine Center, so if you want to drive in and be screened without coming into the hospital, we can manage that as well. The last point that I want to make is that while we are functioning, we continue to be operating as full-service hospitals, and we're still able to take care of the full range of services that we normally provide. We have to do that, and we have to do that safely. There may be inconveniences, though, for people who are coming into any of the hospitals in this region, and that mainly revolves around visitor restriction. So we ask the public to have some forbearance if they're not able to have the usual communication with inpatients that they normally have, but this is for everyone's safety.
Thanks very much. I'll be very brief in my comments, but I did want to say that We appreciate the public taking these social distancing measures very seriously. I know it's inconvenient. I know that people are a little bit frustrated with it, but it is important. It's important to slow the spread of the disease, not only in the general population, but as Dr. Patterson alluded to, it's very important to attempt to slow the transmission from the patients to healthcare workers as well. One of the things that's concerning to me as an emergency physician, a lot of people don't realize that in addition to being the Surgeon General, I'm a practicing emergency physician. I did 4 night shifts last week, and I missed the last press conference we had on Thursday because I was working in one of the local emergency departments. And it's concerning to me how transmissible this virus is from patients to healthcare workers. We appreciate people taking these social distancing measures seriously, and also, as Dr. Patterson said, not coming to the emergency department unless you absolutely need to, because we need to protect our healthcare workers. I've heard from a number of emergency physicians, a number of emergency nurses, a number of paramedics from around the state who are very concerned that in short order we're going to have a significant spike in volume, and that with the transmission of the disease to our healthcare workers could potentially lead to problems. So I just want to say thank you to the public for continuing to abide by these measures, and also thank you to the hardworking people who are working in the trenches around the state, in our emergency departments, in our EMS system, in our hospitals. You're doing an incredible job, and we are very appreciative of that. So thank you very much. And if you are sick, if you are ill, our hospitals are open to see you, but please use wisdom and discernment. Thank you.
And I second the fact that our healthcare workers are courageous. They're out there on the front line doing an incredible job, and are doing everything that our system is designed for to protect the public and to address this national emergency as the President has declared. The limitations that we have are national limitations. They're not really Arkansas limitations. And that is greater capacity in testing, in which we're dependent upon the manufacturer to get us the machines that we need, that we're capable of buying, that we're ready to buy and ready to deploy. It is about personal protective equipment that we are waiting for their arrival next week. And then beyond that, to be able to get in the supply chain line so that we can get additional equipment. And so what we are facing are national challenges that I know that the Vice President's office, the CDC, are working diligently to address. But there is that urgent need for us to mobilize both in terms of a manufacturing capacity, in terms of a asset allocation process, that we are able to get what we need here in Arkansas. And I've been in touch with the White House. I'll be on the phone Monday with the Vice President, and we're, again, as Dr. Patterson mentioned, working with our federal delegation, in which I fully briefed yesterday, and they're engaged trying to get us the resources that we need as well. Finally, I'll mention that Northwest Arkansas is an area that we did a substantial amount of testing early on, and they were negative, but there is a great deal of concern as to what the current status is because of those that are lined up for testing and requesting assistance. And I want to applaud, I know that Washington Regional Medical Center, Mercy Health are both working on out of the emergency room location or distant locations for the testing. Washington Regional Medical Center has one that's already set up. And I don't know if you have the details on that you could provide.
So Washington Regional
Why don't you come forward to the microphone?
So Washington Regional also has an online portal as well, so you can contact Washington Regional healthcare professionals in the Northwest Arkansas area if you're concerned and you want to be screened online, and they're doing a great job with that.
Thank you. And with that, we happen to turn over for any questions. Okay, yes. Representative.
Your leadership and everyone who's on the front line. Your office has been great to answer some of my questions. I think one of the most pressing questions that I have right now is I'm concerned about college students who are going off to their schools, their homes, where the areas are greatly infected, because I think y'all have been doing a great job with what we have here, and them returning. Because some of the students been watching closely. Not every school has completely canceled school for the rest of the semester. And so I'm thinking about the kids who have to travel to Dallas and some of the other places that have a really great outbreak, greater than what we're experiencing here, and coming back here even if it's April, and what that might look like for us, or if y'all can think through it. I'm pretty sure y'all already thinking through it, but.
Certainly, and Representative, thank you for your support. I'll let them address it from a technical medical standpoint, but practically when students go on spring break, or in the college now, many of them are doing online courses and they have more flexibility of movement, parents and young people need to understand that you can go about somewhat normal activities, but you have to practice good health policy in terms of social distancing, in terms of avoiding large population environments in which you don't know where everybody is from. And so parents need to educate their students and young people as to what this means, and you can travel, but how are you going to travel? And whenever you come, who are you going to associate when you go there with? And when you come back, you've got to understand that you're going back to class. So school should be reconvened whenever we return from school break. It continues across Arkansas, but I hope that school will be reconvened here in Central Arkansas area after spring break. And so they just need to plan and act accordingly and be careful. I actually have two students, one college student on spring break with me right now, but they're doing what they should be doing, and students can do that. They need to understand their responsibility. Anything else on that? Yes, ma'am.
I have a question about the epidemiological picture right now, given what Dr. Bledsoe said. What do the guys at your department say about what they think the picture is for spread in Arkansas?
We have four clusters right now, or four individuals, and we're evaluating their contacts, but it's likely that we'll find additional individuals who are not related to any of those known cases. And as we identify new cases, we'll do testing of their contacts, get a better idea of where COVID-19 is spreading in our state. We're also doing these tests from more ill patients who have syndromes that are more consistent with COVID-19, so that we have a higher likelihood of getting a positive test, so that we can find what parts of our states are being affected. Right now, there are a lot of gaps in our knowledge in terms of the epidemiology. This is very rapidly evolving, very rapidly moving, but we'll incorporate each new piece of information and use that to guide our additional investigations.
We saw the Ohio governor, I guess, said she was predicting, based on a CDC study, that 100,000 there, because of their population, sort of like 1% of the population.
COVID-19, yeah, COVID-19 is proving to be a highly communicable virus, and seems to be able to infect a large proportion of a population in a fairly short period of time. This is a new situation. Remember, 3 months ago, we hardly even knew what this was. We're learning a lot of lessons, and it's really difficult to make predictions when you don't have much past experience. But what we're seeing now, we're expecting more cases and preparing for that likelihood.
I'm sorry to keep asking questions. Are we, if someone else go on, I just wondered if we changed the protocol now that there is an instance of community spread. Is that part of the question anymore, whether or not you have been come in contact with a known person?
That's correct. That's why we're also testing those who have syndromes that are very characteristic of COVID-19. Obviously, we don't have the testing capability at this point to test everyone who has symptoms that are possibly consistent, but we're selecting those who have have more severe illness, who have syndromes that are more characteristic of COVID-19. We'll continue to do that, and we'll continue to evolve our testing strategy as we gather more information and as we have evidence of spread perhaps to other parts of the state, and also as our testing capability grows. Remember, we do have commercial labs outside of the state that are doing this testing, and many patients who've had swabs collected and sent to those labs. There's a turnaround time there, and we haven't gotten very many of those reported results back to the health department at this point, which is difficult when you're trying to manage a rapidly evolving situation. But hopefully we'll start getting some of those test results in next week and help fill in some of the gaps in our knowledge. But right now we're utilizing our public health lab capacity to give us as quick a turnaround as we can to identify where this is moving from known cases outward.
Other hospitals will have the test besides UAMS.
Again, the commercial labs are really where probably most of our hospitals are going to be depending in the short to medium term. UAMS has been working hard to bring that capacity in-state, and Chancellor Patterson can talk more about that.
Yeah, so while we're developing the capacity is not going to be restricted to patients who only come to UAMS. So this will be capacity that will be available in collaboration with ADH to determine how we triage this testing for anybody within state. So it's not by any means an exclusive resource for patients who are at or coming to UAMS.
And just to clarify, there's at least one other hospital that I know of that has also ordered equipment, is planning on hopefully at some point doing that testing on site. I don't know what all of the hospitals in our state are planning to do, but I do know that the equipment is basically on back order, being prioritized, which is why we don't already have more equipment in state.
Is that Washington Regional?
Let me go in, Dr. Bledsoe's.
Let me just make one comment to that. One thing I would like, if you're an emergency physician, an emergency medical director, or a hospital administrator, or a leader in a EMS service, I think what changes regarding there being community spread now is that those groups, we need to be talking seriously about how we're going to handle patients with respiratory symptoms when they end up in the emergency department and when they end up in the ambulances. So, my request to the folks that are making those decisions is now is the time to get serious about thinking about triaging patients to maybe a tent in the parking lot if they're stable, knowing how to handle these folks so that it doesn't get spread in the waiting rooms of our emergency departments or to our clinical staff. I'm obviously very sensitive to the fact that this is being spread very quickly to some of our healthcare providers. And so we as healthcare providers need to be making serious decisions about how to limit the spread to our caregivers to protect them and their families.
Any other questions? Yes, ma'am.
Do you know how many people have been self-quarantined that have come in contact with those 12 cases?
Dr. Smith.
We have over 200 individuals that we're monitoring, but there are many others who are self-quarantining for travel purposes that we're not able to monitor that closely. So it's a large number.
In terms of the testing, how are you allocating that geographically? Like, is it focused on the 4-county area, or are you trying to find new clusters in other places?
We don't have geographic criteria. We're basically doing this based on known contacts to known cases, and then also those patients who have a syndrome that is most consistent with COVID-19, which at this point is mostly hospitalized patients with severe illness. So we will go, the geography will be determined by where the patients are.
Do you have a backlog of like specimens that have been submitted?
We are currently caught up with specimens that have been submitted. We are, the lab is working as we speak. So we will continue to receive specimens and continue to prioritize them and test. But we've been referring a number of the providers to submit those to commercial labs.
Do you need a backlog with the commercial lab?
That I don't know. I don't know even if they have a backlog I just, it takes a certain number of days for them to turn those tests around, though.
Let me add that there's more testing that needs to be done. And so the criteria is more narrowly defined so that it can match our laboratory capacity, our testing capacity. And so as we have more testing capacity, then we will broaden the criteria. And because it's narrowly defined as to what we can accept, many of the other hospitals and clinicians are sending it outside for commercial testing. Any other questions?
On the new cases that are healthcare providers, do you know how they ended up getting infected and what type of protective equipment was used?
These three new cases were providers who cared for the Pine Bluff patient in the intensive care unit setting. That is a setting where it's particularly high risk because the patient is very ill, a lot of aerosols being generated, and so it's the time when healthcare workers are at greatest risk. Again, the PPE, personal protective equipment, consistently used is effective, but there was a period of time before COVID-19 was suspected for this patient.
Thank you very much for giving us time this afternoon. And just for the future purposes, we will plan tomorrow and later today perhaps, as we get more testing information on the Department of Health will put that out in terms of a press release, and so it should be on a regular system. And so I don't expect to see you tomorrow, but we will want to make sure that we convene as necessary with our health team to communicate clearly to the public. Thank you very much.
Can I ask one more